time for a mouth to be treated?
That's good for you.
Give me, so how long does it take to finish the procedure?
Let the least, like let's say you go when you see the horse and maybe, oh, this horse is fine, this is a great mouth.
Right. Well, usually the least time I would take would probably be about 20-25 minutes. Because usually I got to do a little bit on the whole mouth. I very rarely will see an area that I don't have to touch at all. And then something really severe, maybe an hour. I'm resting the speculum. I'm closing the mouth and giving them a rest in between. It's not like an hour solid, like let me go.
And then the next day, just the continuum of that question: do they feel a sensitivity like when I have my girl's feet done? She's a little bit owie the next day.
It's different because they don't have feelings in their teeth like you and I would have in our teeth. They have root pulps in their teeth, but they're down deeper in the tooth than yours or mine, and they also recede. Meaning, if I grind some tooth away, I'm getting closer to it. The root pulp repairs, recedes, and goes down, so that it's never sensitive close to the surface.
Do they ever get cavities?
Mm-hmm. They do. Yep, and we can fix those too. Not as common, but it does happen. I actually have a skull here with a cavity. I believe it's either this one, maybe. Yeah, there you go, right there.
Oh, wow. And would that be from feeding them like sweet food?
Nothing to do with that, no. I understand the teeth are grinding away all the time and wearing away. So usually the cavity, the tooth that has a cavity, usually it grinds away at a fast enough rate that it never goes deep into the tooth. It's basically where the root pulp is, and sometimes you have a little bit of a fault in the tooth, a little bit of a weak spot, and then if food gets packed in there, now you have bacteria forming, and maybe your product would help with that. I'm really interested in your product, by the way. It's, I see a lot of applications in my industry. And once you get organic material, high bacteria count, now it's aiding in rotting that tooth, and it's deteriorating at a faster rate than it's wearing away. Usually it wears away at a fast enough rate that it never goes deep in the tooth. If it does, you've got to grind it out, get the putrefied tooth out, and fill it with a composite to stop the continuation of that decay. Once you stop it, then you're fine. But this is not that common. Maybe 1 in 300 horses will have a cavity, and if not addressed, sometimes you can actually grind the cavity out and take it out of occlusion. If it's not that deep, and there's no more organic material getting packed into that little spot, therefore the cavity just stops. And if it's too deep, you can't grind that much tooth out. This goes narrow into the tooth. That's when you've got to actually do a composite filling.
Do you have a pulse? Do you have a pulse?
Yeah.
In some cases, it's necessary. It's case by case. It depends on the problem. Usually, the older horses need things like that, or young horses with handicaps.
What percentage of horses, Tani was saying you did her horses without sedating them?
A couple of them.
I think those are the ones that might have been kind of older.
Yeah.
I'm not sure if you're standing in front of the camera, so you might be careful. It's okay. It might be, that's fine, no problem. Sometimes if they're older and there's not a whole lot of work to be done, it really depends on the temperament of the horse. I sedate the majority of them because I don't want the horse to make a sudden movement with the motorized tool going off, and it's just, and we don't sedate real heavy. I look at, if it's an old horse, the vet usually sedates really, really light because they are old, and you don't want to hit them up with too much drugs. And it depends on the temperament. Some horses are just hot. They can be 20 years old and a firecracker. So if they're that temperament, you do it progressively. You give them a start of sedation, and then the vet will see how the horse is reacting to me. And if it needs a little bump, then we'll give it a little bump. But it's done in a safe way. They're not falling on the ground, or it's not some scary. There's nothing to be afraid of. Yes.
Is that the apparatus that holds their mouth
This is
open?
a speculum that holds the mouth, and we can open and release it. I need that obviously so I can get in there. I wear a light on my head, and I'm looking in the mouth the whole time I'm doing everything. So it's not done by feel, because a lot of times you see people doing teeth and they're not even looking at what they do. When I work in a horse's mouth, it's precision work. I'm sitting here, I'm using my tools, I'm finding a tooth that's high, I'm grinding it down, I'm basically sculpting the teeth back to the way they're supposed to be. And it's something you have to develop a really good eye for. It's like anything. You have craftsmen in all types of industries. Some people just have an eye for detail, and some don't. So having motorized tools doesn't mean you're good at what you do. There's a lot of people that, it doesn't mean anything. It's like a mechanic. You can have a mechanic buy a bunch of tools, and he can't tune your engine to save himself. So.
How did you learn what you know?
The International Association of Equine Dentistry is what I belong to. And what you do there, there's a couple of ways you can do it. You can go to a school in Idaho where you go for a week, you come back and you practice what they show you, and you go back for another week, and it's that type of a thing. But I prefer the apprentice approach, where you apprentice with somebody and you're constantly getting critiqued on your work until you're fine-tuned enough that you know what you're doing. If you practice for a week and then you go back home, you're now going back home and working on horses without anyone critiquing you. So, you know, the downside of that is maybe you could be doing some dentistry that aren't exactly perfect. They'll probably be better than what most of the work is being done out there, but the way I did it was being critiqued constantly and fine-tuned. You know, we're talking about minor things that would pick you to pieces on what you're doing until your skill level got to where it needed to be.
Do you have to be an actual dentist? And then
We aren't allowed to legally call ourselves. I can't even say I'm an equine dentist. I can't use that word. It's technically illegal. Even a vet can't use that word, because a vet, to use that word, would have to have done additional education in animal dentistry. You know, it's like a medical doctor isn't a dentist. He's a medical doctor. He can work in your mouth. He can pull your teeth out if you want to let him. He legally can do it. But is he an actual dentist? No. So we can't call ourselves dentists. We can't really hardly call ourselves anything anymore. They've got so much restrictions on the language we can use. But
what does your business card say?
I've altered it. It just says Brian Borg offering equine dentistry under veterinary supervision. It's like exactly what they want to hear. And
so you don't have to be a dentist as a prerequisite, or you don't have to.
No.
Do you have? Is there any prereqs to be learning the equine dentistry?
It's a matter of you know, getting in. Well, there's a couple of different ways. You can go to school in Idaho. There's a couple other schools that offer dentistry. You can do the apprentice approach that I did, which I felt more comfortable with, because you get to see a lot more cases, and you're critiqued on all of them.
Yeah.
You have to do 250 cases. Wow. And you're critiqued on all 250. So that I felt gave me a wider exposure, which is I wanted to, you know, I've done about 10,000 cases now, roughly.
Okay.
Yeah.
Have you always worked with motorized tools?
When I very first started, I was part of what we have to do is actually get familiar with files. So sometimes you've got to use you may want to use a file for something really small, which is rare. So we have to get familiar with files, because they don't really want you poking around in that mouth until you understand what you're looking at. And so files is what I began with for the first few months, and then they introduced you to motorized tools. You do simple dentistry at first, and progressively do more and more complex dentistry. So I pretty much never use a file anymore. Anything that can be done with a hand file, I can do with the motorized tools and more efficiently and more effectively. In actuality, you're going to get the job done quicker with a file, with the motorized tools, so you're not in that horse's mouth as long, which shortens the length of the procedure. If you're even yourself, you're at the dentist for a long time and you're getting a lot of work done, it's not real comfortable to have your mouth open for a long period of time. So the motorized tools get you in and out of there as quick as possible with an accurate job. So that's another reason why I like the motorized tools.
There's a school of thought that
yes.
the surface on the tools will end up differently by motorized tools with the RPMs and the heat provided by...
That's actually a bit of a fallacy. There was a study done about the heat and damaging the tooth with the heat. It was a really poorly done study. Some veterinarians got a skull, okay, and they ground on a tooth for a minute. They put a temperature gauge in here. A minute and a half and 2 minutes, they found that 2 minutes the tooth got so hot that would cause damage to the tooth. Well, first off, to do a proper study, you would have to do a study on a live horse with blood circulating, because that dissipates heat. It's like a radiator in your car. Water going around the engine dissipates heat. When you have a dry skull and you're grinding on a tooth for a minute and a half on one tooth, it's going to get hot. When I'm doing dentistry, I'm on a tooth for maybe 15 seconds. You see, I'm moving around. And the tool I have, actually, I took the water-cooled mechanism off, because you have water dripping on you the whole time, and water and electricity don't go well together. So what I do is I actually took the little tube that goes here and came out here, and you can attach water to it. That was not very effective as far as having water dripping while you're working, and my little Dremel motor right here. So I just constantly am dipping my handpiece in the bucket of water next to me and working on the teeth. But you're never on a tooth long enough to do damage. So it's great that they brought that up, that can actually damage a tooth, but in the real world, if you have a little bit of common sense and you're working on teeth, it really doesn't happen. And another thing is just to keep this little tip here clean. It gets clogged up sometimes with the grounding parts of the tooth, and if it's the less sharp it is, the quicker it's going to get hot. If it's sharp, it cuts through the teeth effectively. If it's dull, it'll start getting hot. So it's keeping your tools, your disc, throw it out and get a new one periodically. And then I have a little wire brush that I clean it often while I'm working. I'm dipping it in water. So as long as you're irrigating, you're not going to have a problem. But it's a good question. A real good question, actually. Yes.
Brian,